Let's take a quick look at the new management reports available in WebChartMD. There are 13 new canned reports that help you drill down on key company productivity and profitability metrics. Each report is easily customizable to suit specific reporting needs, and once we take a look at the reports, I'll show you how that's done. Let's talk about those key reports in summary. The daily bill amount report gives a daily update on your billable amount in dollars for every account and dictator. The daily bill lines report gives a daily update on billable lines or whatever your metric is that you bill the client on for every account and dictator. The daily pay amount report gives a daily update on the payable amount, again in dollars, for every transcriptionist. And the daily pay lines report shows you a daily update on how many lines were produced by every transcriptionist. Now, the gross margin by account report shows you the gross margin that you're earning for each account, both before and after QA, for any time period that you set. The gross margin by dictator summary report shows you the summarized gross margin earned for every dictator, both before and after QA, again, for whatever time period you set. The details version of that report shows you the document by document gross margin that you've earned for every dictator and account. And so it's a breakout of the summary showing you the details for the gross margin on the document level. The gross margin by report type summary shows you the gross margin for an account and dictator on every report type transcribed, both before and after QA, so you can see whether certain report types might be earning you more or less income. The gross margin by transcriptionist summary shows you the gross margin for each of your transcriptionists, looking not only at his or her own pay, but also by how many of his or her documents required QA to be done. And the details version of that just takes all that data and breaks it out on the document by document level for each of your transcriptionists. So it shows the document by document breakout of gross margin for each transcription by looking not only at his or her own pay, but also at how many of his or her documents pass through QA. Now, the lines per weekday average helps you plan capacity requirements by showing you trends in how many lines are typically transcribed each day. That same report looks at your volumes by minutes rather than lines, so it helps you plan your capacity requirements by showing trends in how many minutes are being transcribed each day. The QA pay summary generates your QA pay amounts for a given time period in summary form. And then the details version of that report shows you the same information, but breaks it out on a per document basis. Let's now run those various reports very quickly. I've logged into my test account and I've clicked on the reportings area or reports area. And here are the suite of canned reports that I have already. If you've seen the Report Builder video already, you've seen the Report Builder section covered. If not, that's covered in video 1, the general orientation. But here we are in management reports, and here are the new available canned reports. The top one, the line count report, is the one that has already existed in the system that probably many of you already use. Let's take a look now at the new canned reports that I've just described, starting with the daily bill amount report. When I click on that report, I'm brought into my report criteria screen where I can load in my date range for the report. Now, as we discussed in the orientation video, you can set up the filter so that this automatically runs month to date, so that you're able to see this report on a daily basis to see how the month is playing out for you on a day-by-day basis. Now, I'm going to set my date range to the date where I've got my, my demonstration data, and I'll click Create Report. When I do, I now see my data, in this case for the month of June, which I had set, and I see running across the top every day where production occurred, and in your case, it'll be every day. In my case, in my test account, it's not every day had test data in it, which is why it's not showing every day. But then you'll notice a total row showing me how much work was transcribed each day. And then for each of my accounts and for each of my dictators, you see the pop-up, there's Dr. Harris, here's Dr. Miller. It shows me each day what my bill amount was to the client and to the, not only to the account, but for the dictator on a day-by-day basis. Now, if you'd rather have your providers in your columns and your days in your rows, you can flip those two axes around to display the data any way you want. But in my case, since I've got quite a few dictators, I chose to list all of my accounts and dictators in rows. But you can see then how powerful that tool is in showing me what my billing is for every day. I can then export my data to Excel or to other formats, and I can automate this report so that it's sent out each day automatically to my team and my clients in the case of certain reports, but I'm going to cover that in a later video. All right, let's take a look at that same data. Now, instead of being presented in dollar amounts, let's take a look at it in lines. So here's my daily bill lines report. And just like I did with my dollars report, I'll go back in and I'll set my date range that I want for my, my test account. And when I click create, my data will now create for me in a lines variation instead of a dollars variation. And here's my data. Now it's presented in the exact same format, but instead of seeing the dollar amount, I'm seeing how many lines we're transcribing for each account and for each dictator on a daily basis. Well, just like it can be done for my bill amounts, it can be done for my pay. So in my daily pay amount report, I want to see and track on a daily basis what I'm paying my team to get our work done. So I set my date range, I click create, and my data presents for me. And now for this report, since I've got fewer MTs than I have dictators that I bill, I decided that I want to run my MTs along my columns and my dates along my rows. But you can see it's the same data. Now, if I want to kind of flip those and run my dates across the columns, I just come up and hit the Edit Report button and go in and make that edit to the report. Now, the daily pay lines, just like the daily bill lines, presents that same data in lines rather than in dollars. Let's keep moving through the reports. This is a neat one, my gross margin by account. I want to see what my gross margin is for the month for all of my accounts. So I set my date range criteria and click my create button. And I'm able to see now for each of my accounts some very important financial metrics. Let's take a quick look at one of my rows. So for advanced orthopedics, for example, we transcribed 201 documents. It cost me $720 in MT time. It cost me $50 in QA time. So my total cost to get those 201 documents done, at least total cost meaning my MT and QA cost, was $771. I billed the account $1,141. So my margin broken out, first before QA, my margin was $421 or 36%. When I include my QA costs, my margin was $371 or 32%. And you can see for each of my accounts, I have that level of breakout, and across the top in gray, I have my totals for the period. So if I want to look at just my totals, I can see that my total MT and QA cost to do 943 documents in the period was $3,451, and I billed out at $5,481. So my margin before QA was $2,455, and after QA was $2,030. Now, if instead of wanting to run the report on all of my accounts, if I had just wanted to run this particular account on one of my accounts, I could have added my filter. And I could have clicked the drop down, chosen facility, and after choosing facility, I could then go in and choose a particular facility to run the data on, like advanced orthopedics. And then instead of all of my accounts showing up, my gross margin by account just for advanced ortho would show up. Now, let's say we need to go deeper than just a high view of what's happening at the account level. I want to see my gross margins at the dictator level, and that's your next canned report. So here's my gross margin by dictator, and I set my time frame and I click my create button. Now here I am with my data, my results for my gross margin by dictator. And this, by the way, is the summary version of this report. It's also available as a detailed version that shows me the document by document details. But here is the summary. Let's take a quick look. Here at the very top are my grand totals. So as we saw before, 943 documents during this billing period. And at Advanced Ortho, we did a total of 201 documents. And now I see the breakout by dictator. So for example, Dr. Harris, 48 documents. My MT cost was 178. I had no QA costs for Dr. Harris. So my total cost for MT and QA was 178. I billed at 274. So my margin before QA is $95.84 or a 34% margin. And then after QA was $95.84 as well, or a 34% margin. Now you could see the value that data like this can provide you. I might be able to say, well, here's Dr. Vezi. My margin, my QA margin as a percentage is lowest actually with Vezi than any of my other dictators at this account. Why is that? Or I might say for Crossroads Neurology, why is it that one of my providers, Dr. Reed, had such a high margin, 57%, even after QA, where a different dictator, let's say, for example, Dr. Thill, has a margin that's at only 29%. Why am I making less money off of Dr. Thill than I am off of Dr. Reed, Dr. Samuel Reed here? And then I can drill down further to look at those documents, look at how much QA is being done, for example, look at my pricing, look at my settings for my line definitions, and come to some conclusions about why certain doctors cost me more and why certain doctors make me more. Now, one of the other canned reports that might help me drill down and determine why certain dictators make me more and some make me less is this report called Gross Margin by Report Type. And this is the summary version. It can be done in a details version as well. And you'll notice my little scroll bar at the bottom helped me to see my report names in full. But gross margin by report type, summary, let's take a look at that report. So I set my date range, I click my create button. And now instead of summarizing by provider, I'm able to summarize by report type. And so let's pick on Advanced Ortho again. Here are the different report types we type for them. The care provider name doesn't fill in this case because it's aggregating the data by report type rather than care provider, so therefore it wouldn't show. In cases here like Carry Ortho where there's only one dictator, then of course there's nothing to aggregate, so the dictator's name will show up. But let's take a look at this. So here are my different report types. I can see how many of each report type were typed in my DID column. I see my costs. I see what I billed. And let's just pick on one of them as an example. So here's my consult, my first row. We typed 24 of those. My MT cost was $146. I had $10 in QA costs, so $157. is my total MT and QA cost, I billed out at $258 on that type of report. So I can see that my margin before QA was $112 and change, or 43%. After QA was 101. And so my overall margin after QA, when considering my MT and QA cost, is 39%. And I can see that out of the different report types that we type for advanced ortho, I'm making the most money off of the consults. And that might give me information I need to know to figure out, well, why don't we make more off of the discharge summaries? This one here, 26% margin after QA. What is it about my workflow or the template that's keeping me from making more money off of the discharge summaries, and what can I do about it to try to get that number up? So you can see how incredibly helpful this type of data could be for you as you try to optimize your profitability. Now, this, as I mentioned, is the summary version. If I want to see the details on these reports, I can get it with a mouse click. I just come into my Edit Report section and uncheck the Group By feature. If you were with me on the first video, my orientation, you were able to see all the different ways I can subtotal and group my data. And with a mouse click, I can uncheck so that instead of my consults being summarized on one line, I can see each and every one of these 24 consults, so I can see who typed them and what may have been contributing to why I was making or losing more money on any given document. Now, the next report that gives me a great snapshot of what's happening is my margin by transcriptionist. And I have that available too, both in the detailed level and at a summary level. So let's take a look at the summary report for those details. I set my date range. I click Create Report. And now I'm able to see my data and all of that same information, but presented at the MT level. So for example, I had to pay Jordan $237 for the reporting period. Now, this particular report doesn't have the DID column, but I could quickly and easily add that to see exactly how many reports Jordan typed in the period. Now, I paid her $237. There was only $1.42 worth of QA work that was required to be done on Jordan's work. So that's pretty good. So Jordan is one of my MTs who requires the least amount of QA work. So my total cost on those documents was $238 and change. I was able to bill out $664 on Jordan's work. So my margin on Jordan before QA was $427, and because so little of her work had to go to QA, look at this, my margins after QA were almost as high. And so my margin from work that Jordan types for me is 64%. Now that's a pretty staggering statistic to see on screen, especially when I compare her work with other MTs that type for me. Here's Joanne Lee at the bottom of my list, and my margin was all the way down to 27% on work that Joanne Lee types for me, because so much of her work here, $248 worth of QA work, has to be done on the $1,000 worth of work that Jordan types for me. And in actuality, this is what I paid Jordan. So for the Joanne Lee, I paid her $1,000 and change. I needed $248 worth of QA work to be done on Joanne. So my total cost for that work was $1,248. I billed $1,720. In other words, the value of the work that Joanne did for me that I was able to bill out is $1,700. So even though my margin prior to QA on Joanne Lee was pretty high, $719, after all of that QA money is spent, it drops all the way down to $471, which is what yields me my 21% margin post QA. So this type of data can be invaluable for you if you're not already tracking it on not only MT productivity, but which MTs I make the most money off of and which MTs cost me the most to deliver a final product to our clients. All right, let's take a quick look at the other reports. The invoicing I'm going to hold off on because this has to do with a different feature that we've installed for you that has to do with allowing you to run invoicing details from the system. So those two will be covered in a different video. My next report is my lines per day. And what this report lets me do, as well as the minutes per day, is help me perhaps schedule my resources for how many transcriptionists I need to have on hand for each day of the week based on my averages. So as I've done with previous reports, I'll set my time frame for the report, and then I'll click my Create button. And I'm now able to see on a lines metric, okay? So my other version of this report is in minutes, but here it is in lines, and it's showing me how many lines are being transcribed each day. And of course, in this case, my data is based on my test account, so there's not a lot of data to show, but what it does show you is what days are heaviest and lightest for each of the days of the week. And it's showing to me both in the values for each account and then as averages. So in my total column, I see my averages. And then under each of the account, I see the real amount of lines that were typed. So for example, taking a quick look, I can see that on this particular report, and I know this is not your trend, because typically Fridays are a light day, but in my test account, Fridays are my heaviest days for lines on average. I do 42 lines on Fridays as an average. But then I can see my data broken out. My advanced orthopedic account does 48 lines. My Carry Ortho account does 26. My Crossroads Neurology is my heaviest account on Fridays with 87. I can see that my Danville Regional Medical brought my averages way down because I had a very low amount for that particular account. But you can see how this would help an MTSO plan for planning purposes know which accounts had the heaviest and lightest volumes and which days of the week had the heaviest and lightest volumes. And if I were to run that on minutes, I'd see that same data expressed in minutes of audio that's transcribed rather than my lines that are produced on each day. My last two reports have to do with my QA pay so that I know what I need to pay out in the billing period and pay period for my QA staff. And that particular report presents both in details or as a summary. So let's take a quick look at the summary report. When I do, you'll notice there's an additional dimension added here, and that's the iteration status. So in this case, since it's a QA report, I'm looking for lines done in QA only, and that's why that's checked. And I'm able to go in, as I always do, and set my time frame for my report. I'll click the Create button. And when I do, I now see my 3 QA people and what they produced in the period and what I need to pay them. So Faith, for example, my top row, she QA'd 4,444 lines. And I pay her $4.25 per line, so I know that for this particular pay period, my paycheck going out to Faith will be $188.93. It also totals everybody up so that I can see my grand totals on the top line. Now, the last thing we'll quickly take a look at before we close this video out is how these canned reports can be customized. And you may recall that when we looked at the gross margin by transcriptionist report, I really wish that I had the DID column presenting as well, so that I could see how many documents were transcribed by the transcriptionist in the period. So let's add that. So I'm going to click that report. It's my gross margin by transcriptionist dash summary report. And I'm just going to come up and click edit report. And when I do, here is the report and the various columns that I decided that I wanted to include in that report. Now, if you've not seen the initial video 1 orientation video, I described in that video how you can drag columns from the exclude section down below into the include section up above to create reports. Now, in this case, my report is created. These are all the various data metrics that I wanted to see in my report. But now I want to add DID. Here's how easy it is. I just scroll down. I find my DID column. I place it where I want the data to present on my report, and here it is. I see my preview create over in the form to the right. So here's my DID column, and I placed it right after the period. Now, period, by the way, simply is where I define how often I want that report to run. So by default, I want to run that report and see that report each day, so I know the previous day's activity, and so I can watch my month build out. And so that's why for the report, the period is preset to month to date. And that's the way I want to take a look at it. So I've added my DID, and now I'm going to click Save. And when I click Save, I've now added that report in the My Report section. Here it is, gross margin by transcriptionist dash summary. So when you modify a report, it pulls it out of your canned report section and adds it up here under your My Report section. So let's run that. Now that I've made the modification, let's go ahead and run that so I can see that data. And I'm going to set my time frame, and I'm going to click Create. And when I do, you can see I've got the exact same report I had earlier, but now I know exactly how many files each transcriptionist typed in the period. So it's simple to modify the reports. And in fact, if I now wanted to go one level deeper and see the 171 reports that Jordan typed in the period, I could add that so that I could see the details for each of the reports. So that's a quick look at the new management reports we've added in WebChartMD. We will have group training on this topic, but if you'd like one-on-one training on how to run your new management reports, it's available. Just call us at 877-386-6677, option 2, or email us at support@webchartmd.com.